I'm Mimi Riley. You probably figured, well, you may not have figured that part out because it says Margaret Riley, which is my official name that I never, ever, ever use. So I use Margaret Riley. I'm going to say this now just in case we run into time issues. Please check, you'll see on the website, on the faculty pages, you'll see my email. You may well have questions you want to ask well after this meeting. Please feel free to email me anytime. We can go. I do this every single year. I have several conversations with students. Usually you end up coming. It gives you a chance to think about things and then come back to me. And I'm happy to do it. And if needed, send you off to someone else who might know more about what you're particularly interested in. So feel free to do that. I usually try and start this so I can just gauge interest in different areas, because one thing we'll talk about is health law is an enormous field. So when we think about what's health law, first thing I'll tell you, it's a relatively new field in law schools. Relatively is in my spectrum, not yours. You're a lot younger than I am. The field did not exist when I was in law school. There was the former secretary of HHS was a faculty member at Columbia when I was in law school there. We did not have a class in health law. We did not have a class in FDA law. We did not have any classes at all related to health law. In fact, not that many students took administrative law, which was kind of crazy in my now world. But since the 80s, it is a field that has burgeoned. It's also probably, not just in law, but just in the economy generally, one of the areas that is somewhat recession-proof, somewhat AI-proof, and law firms and other entities are hiring like mad in this area. So I find that my students are never having trouble as they're thinking about it. And it could be from public service, or it could be straight into, I'm going to be a pharma lawyer. You can think about it all the way through in the spectrum. It's in the news every day. One thing I do in all my health law classes is we spend the first 10 minutes of each class on current events related to health law. You're not allowed to just talk about anything you want. But that's almost everything. And in fact, these days, there's so much I usually have to cut it off. And we'll just save it for the next day or whatever. But that tells you something about what's going on in this area. I never get bored. I sometimes crave boredom. I have to update my slides every single year because something is happening. So that tells you something. I joke I'm going to teach Admiralty next time and just coast along. If you are someone who is interested in a dynamic area, health law is one of them that you can really find a place for yourself. And just in the descriptions that you made as we were talking about it, what you'll see is there is a niche for everyone. And part of that is in the process of law school, finding that niche, how you want to do it. So we talk during COVID, you can imagine how busy I was. I was actually in the law school a lot during COVID because we had a whole strategic group working on issues on COVID nationally and just in the school itself. We have measles outbreaks. We have new drugs. GLP-1s have changed the full landscape of how we're going to do it. They've also changed the regulatory process. Lots of bioethics issues, and with AI, it's a new frontier that I'm working with. I was just on a national NIH committee that actually did a report on how AI is going to affect medicine. And so that's an area that's changing. Mental health law is one of those areas we have a lot of work to do still. We've made some progress, but it's only incremental, and some of that is changing the way society looks at it. I work especially in biotechnology, so for those of you doing that part, you'll find that that is an area, when you combine biotech with AI, it turns into steroids. not literally, but lots of different issues that we're struggling with, but really exciting issues that will change things. Public health, up and down, we're really, the public health is going to be full of opportunities because it's an area that's had some struggles recently and is likely to have to be rebuilt. I always tell students, think about how you want to be in place to fix things when those opportunities come up. So at UVA, what I would say what distinguishes us, and I don't want to overplay this, other law schools do this too, some of this is endemic to health law, is it's very, very interdisciplinary. Now you may have noticed, and we're working on this, you may have noticed that main grounds seems like a long way away. You're tucked up here in North Grounds is what we call it. And that's got one advantage. The other school that's tucked up here with us is Darden. And one thing that I have been building over the last 5 years are major connections with Darden and their health law, not their health law, their health business groups. And we are now expanding that over to the medical school. So one major project we're talking about for the next 2 years is actually not focusing so much on the regulation piece, but innovation, entrepreneurship. How do you build that? And that means networking directly with business students, law students, and medical students all at the same time, and some engineering students, as you can imagine. So that's a project we're actually building out, and we're making it up out of whole cloth. It should be very exciting, but it's going to be new and very interdisciplinary. But that interdisciplinary piece has always been there. I have a secondary appointment in public health sciences. I have a secondary appointment at the Batten School, which is policy, public policy. I have a chair at the Miller Center. So already just in that existence, you see this piece where I'm working constantly with other faculty across grounds. And for those of you who aren't whos, we call it grounds, not campus, just so you know. So other people doing this, Lois Shepard is sort of like my yin to my yang. She is based in the medical school, but teaches over here in the law school. She is part of a major ethics center. So for any of you interested in bioethics, that center includes Lois, but there are actually a whole number of other people. And I could actually say, in complete fairness, that much of the field of bioethics grew up at UVA. Some of the early pioneers were here, and it still has a role to play in our current life. I work with the nursing school. Let's not forget them. It's actually going to be one of the areas of change in the near future. 2 years ago, we sponsored a conference in Washington. Which of you was the LA? Yeah. So we sponsored a conference where we brought in all the senior legislative aides on healthcare who had been involved in the passage of Obamacare. And we did it not just as a look at what the regulation was, but also business people who were affected directly, hospital people who were affected directly. And we went over two days, an in-depth experience of what was that like to pass it. What did we learn? Interestingly, for those of you who know more or less about Obamacare, the biggest issues were in implementation. People tend to focus on passage and take a deep breath once there is passage. It turns out there's a lot of work to be done afterwards. And it was a really interesting conversation between people who don't normally talk to each other so that they could actually understand what was going on. And we hope to do more of those. I have a colleague at the Batten School who we just hired. I was on the search committee, and I had some influence over choosing a health person. She was Assistant Secretary for Legislative Affairs in the last administration. She knows everybody. As a result, that's actually allowing us to do even more of these issues in policy, and she and I work quite closely together, and we're bringing her into the Miller Center as well. Let's see. One thing we just did at the Miller Center, some of this is also thinking of history. You don't necessarily think what you learn from history, but the Miller Center does oral histories of the various presidencies. We are now doing an oral history of the first Trump administration, which involves COVID, lots of PTSD. We just did for a morning full interview of Francis Collins, who was the director of NIH during that time. There are things that we learn in these oral histories that you don't learn in other contexts. That won't be public for a number of years, but it is archived, so we have that. Here in the law school, I have other faculty working in adjacent areas, so you could argue reproductive justice is straight health law, but because it has major implications with constitutional law and other areas, we have faculty working together in reproductive justice. Disability law, my colleague Alice Abrokwa has a class not just in disability law, but a seminar on pain, which is one of those understudied areas that has lots of ethical, legal, regulatory issues. Digital privacy, big issue, centered sometimes in healthcare. And believe it or not, national security. If you think about bioterrorism, you have to think about national security. And I would actually argue even much broader than that, health law is national security. Sometimes underplayed, but important. Crucial to you as you're thinking about programs, especially if your interest is health law, is to realize what the rest of the curriculum is. It really matters who teaches administrative law. Are they someone you're going to learn a lot from? Administrative law and health law have a lot of overlap. Corporations, if you're going to be working in any kind of health system, you have to understand corporations. I could go on and say all of the law curriculum. When people tell me, what should I take to be a health lawyer? I'll say, go to law school. Take insurance law. You need to understand these pieces. Part of it will be threading your way through, figuring out what your interests are as you go along. Let's see some of the things. I want to make some time to go through. I myself deal with both a class called Health Law Survey, which we designed probably more than 10 years ago now, maybe 20 if I'm honest. So Health Law Survey is designed to be a class that is both good for a student who knows nothing much about health law, or a student who knows a lot about an area of health law, but needs to understand the interplay of the entire field. So it is a survey class. We don't go too deep into anything. We have to cover it in a semester. I have some tendencies myself to say everything's important, but I have learned in teaching to realize I have to pull myself back. I will happily talk to you in office hours about anything, but we pull back and we go through a semester literally from issues of medical malpractice, quality, all the way through antitrust, Medicaid, Medicare, and the various business structures that are involved in healthcare, the whole landscape. In specific areas, I teach more in life sciences. So I teach the food and drug law class. We make that so you can always have an opportunity to take that during law school. And for example, next semester I'll specialize that out into a class on law and biotechnology. Interestingly, food has become a major issue of biotechnology, and so that's required a whole piece. It's not there. I used to focus more on drugs. Now the food part in that seminar has become a very important issue. And then we have various internships at the hospital. My colleague I mentioned, Lois Shepard, she does an internship in the health system where she matches students with a health care leader. Often for law students, it's head of quality because that has a lot of interplay. And you shadow that person working with them, act as their intern, but then every Friday there is a seminar that meets where you all discuss the things that you've learned and really try and unpack some of the issues that you've seen. This is an amazing opportunity in the sense, and one of my pet peeves is people who work in healthcare who don't know what it's like to be in healthcare. So I try and give opportunities for you to meet the people doing that work. One much simpler thing we're doing at the end of this month is I'm bringing a bunch of law students over. We're going to meet with some of the health system leadership, talk about the issues they're struggling. What is it like to do this job? What can you learn from them? And sometimes just seeing, obviously within confidentiality, patient areas. I don't wish this on any of you, but an evening in an ED will tell you a lot about healthcare in America. So I want students exposed to that, and we try and find those opportunities. Other than health law survey, we have health and civil rights. My colleague Craig is going to teach, I think next semester, a class on health law and the Constitution. We didn't used to think of it that way, but if you go all the way past Obamacare, there are more, and obviously abortion and other issues like that. There is a lot of constitutional law focused on healthcare. It gives you a chance to take a deep dive. He's also teaching a class on health law and civil rights. Alice does disability as well as the pain seminar I talked about, bioethics, and importantly, in some ways, any class that you have an interest in, if you can find a faculty interest in, we can also find ways to teach that. They may be one-offs, like our Obamacare class, but they may be something that ends up coming into the curriculum. I hope that then, as the field changes, that means we're changing with it. So next question, I would say, joint degrees. You mentioned the MPH. We have 2 joint degrees right now. One is the JD MPH. With the MPH, we ask that you make that decision at the end of your first year of law school. What we are able to do with it is shorten that from a 5-year period to a 4-year period. And it is an opportunity as life sciences and other fields expand. It's an opportunity for you to have that degree in areas where it might be important. We also have a JD MD. That takes courage. We have one student doing it right now. She is amazing, and I hope that if you have an opportunity, you'll talk to her. Her name is Himani. She's done 3 years of med school. Last year, she came to the law school, and she fell in love with the law. I'm not sure I'm going to be able to, I think we'll push her back into med school, but it's been, she truly has really blossomed in that overlay of medicine and law, and I expect great things from her. But you do not all have to have that courage to play a role in health law. But it is an opportunity. I advise both programs, the MPH JD as well as the MD JD. We have a vibrant student group, the Health Law Association. That group is made up of students who have some of them broad experience. One of the leaders is a former ICU nurse, has more war stories than any of us. Some of them came into this much later. All of them are really enthusiastic. And that group can be anything you want it to be. Simply, we do things like mixers with the med students, the business students, the nursing students. and gives us an opportunity to actually get some networking going on. I can't emphasize, law students need to learn to network. Business students know they need to network. Law students need to understand they need to network. It gives you an opportunity to understand your future clients. So I try and find as many opportunities for that as we can find. The other thing we do sometimes with HLA is if you're interested in a symposium like the Obamacare, we could do that. It could be here, it can be in DC, probably not anywhere, but in those ways, DC gives us opportunities to actually bring in people from Washington who want to come to Charlottesville but don't have the time. So we do those pieces as well. And I can do that through the Miller Center connections and the Darden connections as well. One thing we thought of doing this year, I just haven't gotten around to it, is something much simpler. Watch an episode of The Pit together, and then bring in one of my colleagues from the ED and talk about the issues that we're seeing in there. It's, you know, in The Pit, I don't know how many of you watch it. In The Pit, you get in an hour, you know, at least a month of issues. And so what it allows us to do is have a more real world discussion of some of the things we're studying. Where do our students go? The answer is everywhere. Now, how many of you are double who's, potentially? You know what that means. They don't. They're looking at me like I have double heads. A double who is someone who went undergrad and, or I guess 2 degrees as long as, so you have that. So Virginia is a little weird in a sense, and I will tell you this as someone who went to Columbia when I first came here. The depth of loyalty is extraordinary. And one thing I've learned over my career is UVA alumni love hiring UVA alumni. And they, in fact, end up in law firms creating these groups of UVA alumni. And they all come down for interviews and do things like that together. But it really is an opportunity and has really, in my field, enriched it. So a couple of years ago, 2 years ago, we had the 100th anniversary of the Food Drug Law Institute. I did not do this, but some of the Food Drug Law Institute figured out that I had more students at the FDA than any other professor in the country. And we did a whole program with one of my former students at FDA. Again, that was this sort of UVA network. So we have people from the very top deputy commissioner on down, FDA, HHS, all sorts of areas, DOJ, which does a lot of the litigation in health law, all of those pieces. There have been reductions in force recently, so some of that is attenuated, but in DOJ's, in FDA's chief counsel, we still have actually quite a few law students there. Former law students there. So that's actually, all of these are opportunities, be they permanent jobs or sometimes externships or internships, things like that to think about. Obviously in law firms, we have connections. All those UVA people are peppered through the law firms. One decision you'll have to make as you're thinking if you want to work in the area of health law is, you know, do I want to be the specialist on this piece of Medicare, in which case you're likely to end up in Washington. Do I want to be an advisor for a hospital, in which case you could end up anywhere in the country. All sorts of different pieces the location questions will come up. You can generally work in healthcare anywhere, but it may be different. The good news is the networks run deep, and you will see that as soon as you start exploring it. Let's see, any of my last things. Oh, a little bit on industry, because I didn't talk about industry. We have a number of former general counsel at CVS, for example, the Columbia Presbyterian Health System, general counsel, a number of people in pharma, all with different connections here, so that's allowed us to expand. The former general counsel of UPMC actually is a friend of mine. We co-teach a J-term periodically together, so you have a sense of what it's like to be the general counsel of a major health system. And I think that is a pretty good overview. I've been talking a mile a minute and not giving you a chance to ask questions. So let's stop there. Oh, I did forget one thing. The Health and Disability Clinic. We do have a wonderful clinic that many health law students go through. You have to apply, but if you have interest, you're likely to get in. And for many students, it's a hands-on experience. It may be Medicare appeals. I also had a student working on nursing home issues where they were prescribing too many antipsychotic drugs, which has been a big issue in nursing homes. But real chance for, in either disability or all the fields that are health law, to get an experience actually helping people with specific problems. And it's been a great synergy between the more pedagogical experiences and this clinical experience. So I'll end with that.